Hello and welcome to Acupuncture and the Spine. Uh, so let us talk about the poor, maligned, talked about character in this back pain saga. It's the humble disc. Just about everybody who comes in with back pain says, my disc is gone. Oh, I've got a ruptured disc. I've got a prolapse disc, etc., etc. The news is that in the vast majority of cases, it's not the disc which is causing the pain. The disc is just a soft, pulpy material. It's a bit like gelatine, and you may ask, why do we have these discs here? They're there as a shock absorber. So why don't we just have a solid spine, all bone? It would be much stronger, but the problem is that you'd be walking around and your head would be jarring every time you walk because you don't have the shock absorbency. So discs are very simple. They're soft, pulpy material. They're there as a shock absorber. But when we see CT scans and X-rays, we always see the bones. But what we forget is that along the spinous processes are the main muscles. They hold you up, and it is those muscles which are in spasm which cause the pressure on the disc, and that is what causes the prolapse of the disc, and then the disc may then, of course, impinge or press on some of these nerve roots here. You can see that little red section there. That's representing a little disc bulge, and that may press on a nerve root and cause pain down the leg. However, in 80% of cases, we know that most of the pain in the back is coming from the muscles and the ligaments, in other words, the soft tissue. So please bear in mind that when you see a CT scan or an X-ray showing you the bones, you're missing 80% of where the action really is. So once again, acupuncture is very valuable in the sense that if you needle the muscle along here, this is what's causing the pressure on the back, and this is what's causing the disc to be compressed. So it's well established. Acupuncture is excellent for all sorts of back and neck pain because most of the pain is due to muscular tension and spasm. So the brain works this way. If you bend over, you stretch or damage the muscles or ligaments in the spine, what does it do? It protects the area by tensing the muscles in the area. So this is a natural reflex, and this is how the body protects itself. However, the body often goes into a negative modus operandi. It just gets into the habit of being tense. So some people, they get a bit of a back injury and their back tenses up, and then they're just tense all the time for years and years. They've just got this chronic muscle spasm. So it's been shown that acupuncture, if it's done a course of acupuncture, maybe 10 or 12 treatments, it can give a long-term benefit in terms of reducing the muscular tension in that area. The brain basically needs to be re-educated, and by needling the muscle, the brain gets a signal and it says, yeah, relax, this doesn't need to be so tense. So this has been proven to be a much more useful modality rather than chiropractic or massage, where you manipulate the spine, you twist the spine, and you try to stretch the muscles. Yes, that's all fine, but the brain then says, no, I need to be tense. So it's clearly been shown that these chiropractic massage, etc., will only give a short-term benefit of a day or two, whereas acupuncture can give a much longer-term benefit.